Good afternoon. Welcome to our 5th week of COVID-19 emergency response. And I appreciate you tuning in to get a brief update. You can see by our slides, I'm reminding you where we were at last week worldwide. We had a little over 1.5 million cases recorded and a little over 93,000 deaths. And hold on a second. And then in the U.S., we were at 450,000, a little over 450,000 cases and 16,000 deaths. So we went from, oh, that's an old slide. I didn't update my slides. My apologies. I'm going to look at the numbers and tell you what they are because I failed to update my slides. Okay. So very quickly, I'm going to tell you that worldwide, we have 2.1 million cases and 140,000 deaths. And in the nation, 648,000 cases and almost 31,000 deaths. In California, hold please. In California, we've had 24,000 reported cases through April 14th. Remember, this information is a little bit in arrears. And if you'll just give me 1 second, my apologies. And then 821 deaths. In Fresno County, we are seeing a steady climb in the number of cases. We now have 265 cases with 7 deaths to date. I heard yesterday on a call that we're doubling our cases about every 6 days here. If you compare that to a place like New York City or some of the places like Italy, it's 3 days or even less that the doubling is occurring. So that's something that we'll keep a close eye on. We're now getting information that 59 have ever been hospitalized of our 265. And 62 have recovered. So we'll start hearing more and more recoveries as well. And then now on the Fresno County's Department of Public Health website, you can also, I think I shared this last week, get a detailed report on which cities in our county have cases. And so obviously the predominance of the cases is in Fresno County, in the city of Fresno, and then everything below Parlier has 4 cases or less. So we're not reporting out the cases until they hit a threshold of 5. But as you can see from last week, we've added several of our smaller cities who now have at least 5 cases. I wanted to show you some slides to put COVID in perspective. You might hear in mainstream media, you might have friends or family members say, we think we're overreacting. We don't see a death toll even approaching what the flu is. So this slide shows you the death rate per week per million people. And this is for the United States. So what you can see here is the lowest dark blue line is car crashes. And then the next line is the 2017 and 18 flu. That was a really bad flu season for us. And then you see the 1957-58 Asian flu with pneumonia and the 2017-18 flu with pneumonia. And then at the very top, you see cancer and heart disease. So COVID has surpassed all of those in its weekly death toll, except for heart disease across the United States. If you look at this graph, you can see that those annual tolls for things like the flu are collected over 33 weeks. We are already greatly exceeding these weekly tolls. If COVID were not arrested, if it didn't slow down, if we didn't flatten that curve, then you could expect we would far surpass the death rates from these other health conditions. The next slide is for New York State. So I'm going to go back quickly to the United States. If you see the United States, COVID is averaging around 37 or 38 deaths per week for this 8th week that we've been experiencing it. In New York State, it's over 250 deaths per week. That is more than 6 times what we're experiencing across the United States. So New York is a good example of what's called a hot spot, where we're seeing a much steeper curve of incidence of COVID as well as death. And when you look at New York State, the weekly death toll from COVID surpasses all deaths from all causes in the 2017-18 flu season. So all those things on this prior slide, heart disease, cancer, flu with pneumonia, flu without pneumonia, car crashes, the 1957-58 Asian flu pandemic, is not included in the 2017-18 in the next slide, but in this slide for New York State, all of those things that happened in 17-18, the COVID weekly death toll is 2.5 times higher than that. So my next slide is my attempt at a little bit of humor. We are very close to warning, that feeling of as we flatten the curve, see, it wasn't so bad, we overreacted. When indeed, if we hadn't done our prevention and precaution efforts, we might see a prolonged experience of a very high death toll. So I just wanted to put that in perspective for all of you. I think it's easy the longer we're in this to question, why do we keep doing this? Why are we in this phase? We're not seeing that many deaths in Fresno County. We don't have high cases like other parts of the United States. That's because we're doing these things. And we need to keep doing them until we get past this. So what are we doing? We're doing a lot of the things we've talked about in past weeks. The only thing I want to add to this is we do have the new mask guidelines, which I think we talked about a little bit last week. We are continuing everything else that we were doing, continuing to push out tips and guidelines on social media, working with all of you to be able as much as possible to work from home. We've refined some of our equipment. We're moving to get additional supports to you at home, things like keyboards and mouse and things like that. So that brings me to the next slide, which is when will these restrictions lift? I showed you the prior graph showing what's going on and what we can expect to see if we don't do anything. Well, the governor has created an alliance with some Western state governors in Washington and Oregon, and they're working on what would we need in place in order to feel comfortable beginning to slowly, progressively lift restrictions. So I'm going to go over some things that aren't happening now and will need to happen before that discussion begins to develop a date. So one is we need an increase in widespread testing, contact tracing, and isolating and supporting those exposed. When we've had limited testing, that testing has focused on really highest risk people. So you had to be symptomatic, you had to have had close contact or things like that, or you've been hospitalized. And so not as many tests have been done as we would like to have. We are ramping up testing capacity. Fresno State's agricultural lab has acquired the equipment, and they're partnering with Fresno County to increase testing capacity. Some of our local hospitals have acquired rapid test equipment and are able to do a much quicker turnaround to the test result, as well as many more tests a day because of that. There are some constraints on that, particularly the testing materials, whether it's the test kit itself, the swabs that are used to take the test, or the chemicals and other reagents that are needed to process a test and determine whether it's positive or not. So we are ramping that up. The Fresno County Department of Public Health is also working to acquire our own testing equipment. And you should anticipate in the coming weeks or so some different test strategies to begin more broad testing. The contact tracing, once we tamp down the number of cases, as we see new cases, it's going to be very important that we isolate those individuals, that we very closely determine who they may have come in contact with and isolate those individuals, very similar to what we did in the beginning. As that number of cases goes down and we begin to think about it's time to get our economy going again, we'll want to have in place these tools so that as new cases emerge, and they will, that we track them and we try and contain again. I think you'll recall from weeks past, we talk about the difference between containment and mitigation. And containment is that early stage where you're trying to prevent any spread at all. Once you start to see community spread, then you're in a mitigation phase. And so as you begin to come out of that and you've tamped things down, you have to have these other strategies in place to be able to detect new cases and to go back into that containment phase again. We have to work even harder to prevent infection in our highest risk population, so I anticipate that those populations will be the last to return to the workforce. Hospitals and healthcare providers need to have adequate protective equipment. So we've talked about before flattening that curve, which really is just slowing down the number of new cases. That buys us time to do things like acquire new testing equipment, get enough supplies in, have enough protective equipment. And as an example, in this 5th weekend, we began attempting to acquire masks 5 weeks ago. We had some masks that we had on hand, but we anticipated that those would be depleted, and so we began to attempt. We got our first shipment in today. If we had had a much steeper curve 3 weeks ago, we'd be 2 weeks past that period of time where the equipment finally came in. So the more time we have, the less chance that we run out of ventilators, the less chance that we run out of hospital ICU capacity, the less chance that we won't have enough protective equipment. And so this time allows us to acquire things like masks, acquire things like ventilators, keep the volume down enough that there's enough ICU beds. It also buys us some time to advance treatments. So many of you have probably heard of some of the anti-malarial drug treatments. We're now, it seems preliminarily like those aren't working, but there are some other drugs for things like rheumatoid arthritis that address inflammation that seem like they will work or they might have a benefit, so those are being investigated right now. And there's even something as simple as what's called prone positioning that's being utilized in some of the hotspot areas like New York that they tried in Italy. And this is where, in lieu of putting someone on a ventilator, they're finding if they roll them over onto their stomach, they actually increased oxygenation in the blood. And this is because our lungs are largely in the back of our body. So when you lie down, there's a large surface area of your lungs that if it fills up with fluid, that prevents that area of the lungs where blood's flowing through to oxygenate, because the fluid is preventing that oxygen from getting into the blood. If you roll someone over and that fluid now with gravity goes to the front of the lungs where there's less surface area, then that back of the lungs can get the oxygenation. So they've seen some good results with that. And just an example of this time allows us to learn from both other areas' experiences as well as advance additional treatments, trials, and things like that that might help us better be able to treat people when they have COVID. And also buying more time for a vaccine. We still believe a vaccine is going to take quite a bit of time, but there are trials being done, and we hope that those trials will continue. And then we have to learn how to reshape our physical environments to be able to support social distancing. It may be that as we reopen the economy, you'll still see people wearing masks. You'll still see people standing in line at the grocery store 6 feet apart. You'll still see that at the bank and at other places that begin to open up. You might see restaurants that remove chairs and tables and only have so much, making sure they have so much space between people. Or you might see a period of time where we continue takeout as opposed to in-house restaurant. So those are the types of things that we're going to have to look at very carefully as both public health, government, and businesses to safely begin to reopen. And then the state really has to use those tools to determine how and when to put restrictions back in place if it seems that the opening was too quick, or we're starting to see cases, or we're struggling with the contact tracing, or that type of thing. And so that's really what the governor has announced, what's going to have to happen. What's happening now is work being done to ensure that each of these things is where it needs to be so that they can begin to target potential dates to lift some of the restrictions. Okay, I will just say once again, I'm running out of ways to say it. Don't come to work if you're sick. If you answer all the questions on the screening tool, no, but you don't feel well, stay home. We are screening for what we know to be COVID symptoms, but we also know that people can be asymptomatic when they have COVID, and we don't know if you begin to feel unwell or not yourself or funky in some way before you actually experience the very specific COVID symptoms. So we're begging you, we're pleading you, we're demanding of you, stay home. If you have any feeling whatsoever that you don't feel well or right. I don't know how many other ways I can say it, but please, please stay home if you're sick. In terms of our homeless outreach efforts, really just ongoing work being done to ensure that all of the measures we've put in place are working. We're continuing to work to expand capacity for individuals who are willing to be sheltered. We consistently on a day-to-day basis have between about 325 and 350 individuals who are sheltered and housed. We're expanding our capacity to provide remote medical consults and behavioral health services, and we're doing that in partnership with UCSF and our federally qualified health clinics, where we are placing, it's happened in the last couple of days, iPads in each of our shelter and homeless outreach locations, and through the iPad they can do a medical consult with a physician at UCSF Fresno or with the federally qualified health clinic, and we're hoping that that will enable us to address individuals' medical needs while they're in these shelters. Jolie Gordon-Brower on our team and with her staff is working with the shelter providers to identify individuals who might be in shelters who are our clients or might benefit from our services, and ensuring that while they're there in shelter, we're connecting them and engaging them and hopefully helping them to be able to get the services they need and get housed out of this crisis. This crisis does present us with an opportunity with the homeless where a lot of times when someone's on the street, it's hard to engage them. You can't always find them, or they may not be willing to be engaged. But we're hoping that while people are in shelter, they might be more open to services, more open to engagement, and really we can find them. And so we're working really hard to take advantage of this opportunity and ensure that we are engaging as many people as need our services as possible. All right, we're getting to the question and answers session, and so I'm going to start looking at some of the question. It says, if someone does not pass the health screen, how long should they stay home? Well, what we're saying is if you have COVID symptoms and or if you've gotten tested and had a positive test result, we want you to be 7 days from the start of symptoms and at least 3 days without symptoms. So if you have a fever, if you have a cough, if you have a runny nose, if you have loss of or altered sense of smell or taste, all those symptoms that you're being screened for on the tool, if you're actively ill, we want you to be 7 days from the first part of the symptoms and 3 days without any symptoms at all. And you know, this is hopefully something we all get used to. Regular seasonal flu passes amongst us as well. And if we can get used to washing our hands, not touching our face, coughing into, our elbow, that type of thing, and also staying home when we're sick so that we don't expose other people to our illness, we might actually reduce the seasonal flu as well. That might be something good that comes out of this. Someone asked a question that got retracted. Maybe they took it back. I'm not really sure. I'm going to give it a few more minutes for any other questions you might have. But just elaborating on the question about illness. If you're in doubt, contact your primary care provider. You can always call our human resource department and they could assist you with getting a determination. It will contact public health if we need to. If you're sick with something besides COVID or have symptoms that are different, again, talking to your doctor is probably the best way to go to ensure that you're not exposing other people to an illness that they might get because of this. At what point will we be informing our clients that we will be extending phone and computer services only beyond April 30th? We're still waiting to hear locally and with the governor exactly how long this will extend. I think that I'm happy to work with our leadership team, and we'll come up with a strategy for communication to the people we serve, and we'll get that out to you in the next day or two. A question about, do we still plan to have an all-staff meeting next Tuesday? I'm going to be honest, I don't remember the day of the all-staff meeting, but yes, we do plan to have an all-staff meeting next Tuesday. What we're contemplating doing is infusing some of our, call it more normal routine business into into that meeting. We're really trying hard as a leadership team to both address the immediate needs of the COVID crisis and then also really attend to the routine needs of the department. And so hopefully over the next few weeks, you'll see a little bit of that shift where some of our communications with you will be more routine in nature. What would the changes look like for our buildings? More space between employees, for instance? Those are all the things that we would have to determine. Depending on what guidance is given us by the state and our public health department, we might not bring all of our employees back at the same time, for instance. We might change how work gets done both now and into the future, as far as allowing some telework or work from home to continue. But yes, that would be the kind of thing we'd be doing, is looking at if we were to have more people in our buildings, how could we respect the recommendations that will come? So if we still have to maintain social distance, yeah, we'd have to look at, there might be some workstations we wouldn't want to use at this period of time. We might also have some different recommendations for how break rooms get used, or how often the bathrooms get cleaned, and that type of thing. And so those are all things that kind of fit into that category that I mentioned in that one slide. We're going to have to look at our physical spaces that we work and socialize and do business in, and really think long and hard about how can we make them safe as we continue to go through this. Because remember, whatever period of time that we stay in the current situation, as we come out of it, likely some precautions will stay in place for a long time until we have a vaccine. Another question, I just wonder if staff showing up are concerned about getting paid, and if that is the case, can you explain the resources available? We're concerned about this too. That's why we really emphasize that if you're not well, you need to stay home. I do worry that staff would be worried about getting paid and put themselves and others in a precarious position because of that. So our human resource department through the county has put out quite a bit of information about different resources that are available to our staff who might need to be home to care for children or things like that. And so I will ask at our all-staff meeting next week that we have at least a small presentation on what are those resources and how would you access them, because I don't think I can adequately explain them on the fly here. And then once this stay-at-home order is lifted, how much longer will you wait to have employees return back to the office? Well, again, that timing of when employees would come back would depend on all of those variables that I discussed. So for instance, let's say we had adequate testing in place and good contact tracing and a strategy for isolation, and we had looked at our business environment, work environment, and structured it the right way and such. We'd look at high-risk individuals and that type of thing. And then depending on how long those things took, we developed, I would guess, probably a staged process of how we brought and how many people we brought back to the office. We are not there yet, so I can't tell you a date right now, but I can tell you that likely it would be a staged approach, and it would be dependent on how many safe workspaces could we create in each work area, and how many employees could reasonably and effectively continue to do their work at home. It seems very few tests are being administered as there's still a shortage of tests, or are only those with underlying conditions being tested. While there's been a shortage of tests, they have been fairly strict on the criteria for what it takes to be tested. Certainly if you're a healthcare worker who's been exposed, if you have active COVID symptoms, and I'm going to be honest with you, it's been variable. If you went to an in-the-community healthcare provider and they happened to have a test and access to a lab, you might have gotten tested when someone went to the emergency department and didn't get tested. Now that the hospital has a more rapid test, when people present to the emergency department with active symptoms of COVID, they're able to get tested fairly quickly there. And previously, where you might have to go home and wait for upwards of 7 to 10 or more days to get a test result back, those results are coming back same day now. So we're seeing a much improved, streamlined process for people who have symptoms. But the hope is, as we get into this, as we move into a next phase, we're not there yet, but when we're ready to move into the next phase, the hope is that these additional testing resources at Fresno State through the public health department and these rapid test equipment that are at some of the hospitals will enable us to, we'll say, loosen the criteria and do more broad testing. And so what likely will happen is there'll be some pilot projects done where they pick, say, a congregate care facility, and maybe they test everyone there proactively to see if there's COVID and to develop strategies for keeping COVID out of there. Right now we're not doing that kind of thing because we've had a shortage of tests. But as that changes, I see more broad testing occurring, and it would be easier to get a test. Will we be provided with essential employee letters and cards in addition to our badges as proof that we are essential employees? We have those letters now, and I had thought that they had been sent out, but I believe all of the division managers have access to the letters, and they are providing them to individuals who are currently assigned to come into work. So if you are currently coming into work and you have not received a letter that you can have available, please talk to your supervisor and they can get that letter for you. I will say that I've come to work pretty much every day. I've never been stopped, but I have heard anecdotally that people have been stopped. I don't know anyone who's been stopped, but I've heard through the grapevine. So if you feel like, if you're coming into work and you want one of those letters, please get one. Let's see.
That's it right now.
Okay. I'm going to give it another minute or two to see if we have any questions or comments. All right. So next week, look forward to having an all-staff meeting that looks a little more normal than this, hopefully. I'll try and give a brief, similar update to what I've been doing so that you see some consistency in what's getting reported. But we will have human resources present on what are the leave benefits available to you to support you during this time, should you not be able to work from home or not be able to come into work. We have very few employees at this point who that's the situation, but I want to reassure you what resources are available to you should you need it. And I got one more question. What if we are feeling ill or under the weather, but not of COVID-19 and have to stay home? Yeah, that's your sick leave. You would use it just like you would use any other time you were ill and needed to stay home. And I'm just going to reiterate here. If there were no COVID right now, I would want you to stay home if you were under the weather. There are many illnesses that are contagious that when we come to work, we put others at risk by exposing them to that illness. So we want you to stay home, but you do have to take sick leave if you're home because of illness. We will see you next week. And if you have any questions that we didn't get a chance to hear about today, please feel free to email us in between these meetings. Always more than happy to answer your questions. And I look forward to seeing you next week. Thanks.